healthcare advocacy group in the province, and our Haliburton Highlands Long-Term Care Coalition. So if my team members could just give a wave: Dorothy Owens, Terry Hartwick, Bridget Gebauer, and Georgia Shank, that would be great. So it's fabulous to see so many of you this evening, so many familiar faces, a few I don't know. As I said, over 92 were registered just prior to our beginning the meeting. And how did I know that would happen? Because Haliburton County is the most caring and proactive community I know. I know that from working with so many of you. It shows your strong concern and your desire to find solutions on how we can work together across the province and locally to fight back against the Ford government's plans to privatize our hospitals and to protect our publicly funded healthcare system. We must force the Ford government to address the staffing crisis that he has undoubtedly created to enable for-profits to pull staff from our public health system and to better jobs, to prime jobs with better pay, better hours, and the least difficult patients. We need to be the voice of reason. Our county needs to be the voice of reason and push for investments in publicly funded healthcare and not-for-profit clinics. Our guests, Bernie Robinson, Interim President of ONA, and Natalie Mayra, Executive Director of OHC, will walk us through how we can accomplish this tonight. Ironically or not, today the Ford government introduced legislation reform that is a culmination of so many changes that they've been promising since pre- and post-election last year. It will allow private for-profit clinics to perform more tests, surgeries, charge add-ons that pressure people to pay for items not covered by their OHIP, and more. The writing is on the wall. That is paving the way to continue their government's goal for them to privatize our hospitals unless we stop them, and I know we can. Throughout Ontario and locally, citizens have banded together for a century or more to build up our local public hospitals. We have volunteered, fundraised, and donated from our paychecks because these are vital services for our communities. The Ford government's plan would dismantle our local public hospitals, taking the profitable services out of them, robbing them of desperately needing staff and funding, and giving them to for-profit corporations. Our history strongly shows how important our hospitals have always been for residents of Haliburton County. The first Red Cross hospital in Ontario was created in 1922 in the small village of Wilberforce in the eastern portion of the county. In the village of Haliburton, the first hospital was built in 1936 in the current Canoe FM offices, which we're all familiar with. And in Minden, the first hospital was built in 1956. Tommy Douglas would roll over in his grave as our much valued Medicare system continues to be destroyed week by week. The Canada Health Act, under his passion and leadership, was formed in 1961 with the following principles: universality to cover 100% of hospital and physician services, portability across all provinces, accessibility, comprehensiveness to cover all medically necessary services, and public administration, which forbids for-profit insurers. Riley, could you play the Tommy Douglas clip, please?
Save Medicare from subtle strangulation. There must be no extra billing or extra charges. Well, you say, why? What harm does it do? I'll tell you what harm it does. It means that increasingly the people who can afford to pay the per capita tax, and it's going up, just gone up in Alberta, people who can afford to pay the per capita tax and the people who can afford to pay extra billing will pay it. And they will get the best care. They will get the most experienced surgeons and physicians. They will get into the best hospitals. And the people who can't pay, they'll take what's left. If you want a two-tiered health program, then just continue the way we're going. And I remind you that in this movement we pledged ourselves 50 years ago that we would provide health care for every man, woman, and child, irrespective of their color, their race, or their financial status, and by God, we're going to do it!
Wow. Who can match that one? Well, I do know someone who will match that one at some point this evening. But anyways, moving on. Each speaker tonight will speak and there will be time for questions. I will try my best to see if your hands are up, but if for some reason I don't, please just speak up and ask your question. As I said, I'll do my best. So it is my pleasure to introduce our first speaker of the evening, Bernie Robinson. Bernie has been a registered nurse for over 30 years, who has worked at the St. Francis Memorial Hospital in Barry's Bay, emergency and acute care, complex continuing care, dialysis, telemedicine, and the Lynn Nursing Clinic. She is the interim president of the Ontario Nurses Association and is a board member of the Registered Nurses Association of Ontario. As a retired community development nurse, I sincerely thank you, Bernie, for participating tonight and bringing the message from the Ontario Nurses Association and your membership to us. You are our heroes along with our docs.
Thank you, Bonnie. And thank you to the entire Health Coalition for organizing this very important town hall. ONA represents 68,000 nurses and healthcare professionals across Ontario, including 18,000 nursing students currently enrolled in programs. I'm really grateful to be here with you today and to have the opportunity to share what's happening in our healthcare system now and why we know privatization is absolutely not the answer. At this point, anyone who is paying attention has heard it. Our nurses and healthcare professionals have been stretched beyond the breaking point. They have been working in crisis mode for almost 3 years now. And at some point, it's not crisis anymore. It's actually the new reality. I think we all know that this can't be. We do know from the new Canadian Health Institute for Health Information data that Ontario has the worst in the country RNs per capita. Across Canada, there are only 830 RNs per 100,000 people. But in Ontario, we only have 668 RNs for 100,000 people. This means just to reach the Canadian average of 830, Ontario needs to hire 25,000. 25,000, not 2,500, 25,000 RNs immediately. So what does a staffing shortage of this magnitude look like in actual practice? What's happening out there on the front lines every day is that it's become commonplace for our nurses to be kept at the hospital for hours after their shift is supposed to end. They have to stay because the next shift is either short-staffed or it's not possible to safely transfer the patient care that could be because of patient acuity. We have nurses working on maternity floors in big hospitals where they should have 35 registered nurses on a shift, and the new normal has been reduced to 17 or 18. That does not allow nurses to provide safe and proper patient care. We have hospitals where there are more vacant RN positions than there are actual RN nursing staff. And we know what happens in those places. They have to close their emergency departments, and they have to close other departments that they cannot safely staff. We know that nurses are resilient and they're very resourceful. They always put patient care first, and even in these extremely difficult times, they are finding ways to provide care that they know all patients need and deserve. Sometimes we do this to a fault, but it is the cost of this is really taking its toll. We've seen early retirements raise. We have new grads that are rethinking their careers and are leaving the profession just after 1 or 2 years on the job. Nurses are leaving to work at private agencies where they can ensure they have work-life balance, where they can say no to a shift and not feel guilty because it's not their regular place. There's a very real cost to our healthcare system as this situation worsens. And now the Ford government is using this crisis to justify their privatization agenda. This is an absolute disgrace. Ford has taken an understaffed system and it has made it so much worse. He's introduced Bill 124, which capped our wages of the many nurses and our other healthcare professionals, as well as other private sector workers, and has violated our charter rights. We have won that charter challenge, but now he's persisting in appealing. Ford is refusing to work with healthcare professionals to invest and implement anything meaningful in the way of retention and recruitment. He's left our system severely understaffed with no relief in sight. Across this country, Canadians pride themselves on our world-class universal healthcare system. We believe that access to healthcare should be based on your needs and not your bank account, and that holds as true today as it did when we heard Tommy Douglas speak just a few minutes ago. Nurses and healthcare workers are strong advocates for public, nonprofit healthcare because we know the devastating impacts of privatization. The most broken parts of our healthcare system are the ones that are already being privatized, like long-term care homes and home care, and now surgical suites. Private healthcare will take away from the public care by pulling resources and staff from the public system. And I can tell you, this is already happening. They are already trying to do this in Ottawa on Saturdays. They're trying to pilfer nurses out of the hospital to work on Saturdays for exorbitant rates. As nurses, we've already seen this, and as colleagues, have left the public system to go work for private agencies as well. We can't blame them when they make this choice. The agencies let nurses choose their own hours, and they pay more. Conveniently enough, hospitals have money to pay agencies 3 and 4 times what they pay a nurse, who are not subjected to Bill 124, but they can't, and say they can't pay us. There's a serious cost to this. Those agencies charge outrageous prices, as I've told you, to public hospitals. They don't provide pensions, they don't have benefits or sick days for their nurses. This undermines nursing as a stable career, and it undermines our healthcare system. It siphons off precious dollars and lines corporate pockets. It's disgusting. This will impact access to our quality of care. It's hurting patients who can't afford to pay. We cannot let this happen. Ontario's public health system is not Doug Ford's to dismantle and sell off to his corporate buddies. Our public healthcare system has been built up over generations, and it belongs to every single one of us. The Ontario Nurses Association is here with you tonight, and we will continue to work hand in hand with our allies, with all of our allies, to fight for the investments we need in our public healthcare system so that everyone gets the care they need and deserve when they need it. Together, we can stop Doug Ford's plans in his tracks, and I urge you to do as much as you can to prevent this privatization model. Thank you.
And Bridget Kabauer is going to thank Bernie for us.
Yeah, thank you, Bernie, for your wonderful insights into the worsening crisis of care in this province. We see it in front of us as it's happening, and it's pretty scary. And obviously how privatization is worsening this situation. So thank you so much for your presentation.
Great. Thanks, Bridget. So our second, oh, sorry, there will be questions now. I wanted to put it out to the floor. If anybody has any specific questions for Bernie before we move on to our next speaker. I'm looking for any hands up.
David Skinner has his hand up.
Okay, is he on another platform here? I don't.
No, he's right there. Go ahead, David.
Okay.
Bernie mentioned that ONA has some ideas of how to fight for it. Can you share what they are with us?
Hi. So currently, we are at the negotiating table for the hospital sector. And we currently have a very strong campaign. You can see actually in my top corner, better staffing, better care for patients. You get that by providing better wages, by making Ontario competitive with other provinces, by making nursing a profession that people want to come into, and more importantly, that they want to stay. Because it's okay to get somebody in the door, but you got to keep your nurses. We need the expertise. We need that, that building block, those recruitment and retention priorities to make sure that there are nurses now and there's nurses in the future. We have had a lot of nurses leave because they feel absolutely disrespected by this government and by their employers. Bill 124 capped us at 1% over the last 3 years. Our nurses actually now, a nurse at the top of the pay scale is making $12,000 less than they did years ago against the cost of inflation. Many of our nurses are single parents, and they are feeling the pinch as single parents, even making the wage that they are, because of all of the other inflationary things that have happened with rents, with food, with, gas, all of those things that we all struggle with. And so we know that there needs to be a robust retention and recruitment plan. We know there has to be a better education system to bring new nurses into the profession earlier and quicker. And we know they need to make investments into all of those things.
Great, thank you for that question. Bart.
I appreciate everyone taking the time to address this issue. I'm rather new in terms of understanding this crisis. And so your answers are very helpful. My question is, what is ONA's reaction to or position towards the recent proposal put forth by the federal government to improve provincial access to funds through the Canada Health Transfer? Is it enough? If not, what would be enough? Thank you.
Sorry, I muted myself instead of unmuting myself. So yes, the ONA is supportive of the increase in the health transfer payments. But what we want is accountability. We don't want them handing money over and being used on more privatization. We want true accountability. We want true facts and figures. And we want to make sure that the money goes into our public health care.
Okay, next, Peter Voch. Hi,
Hello.
Peter.
Hi, Peter Voch. I'm a QP retiree, longtime trade unionist in the health and social service sector. I just want to commend Bernie on your talk and on the actions that ONA has taken. This Thursday, there's going to be province-wide pickets. I will be attending, and I hope that all of you are looking at attending. I don't know about Haliburton. I'm nearer to Peterborough. I'm actually outside of Peterborough, but certainly I'll be there. And my question, my comment is that it is really only with the workers on the front line that we can actually make progress. And this is how we won the fight against Bill 28, the notwithstanding clause, where the education workers had organized for many months before. It did not happen in November. It started happening in the spring. A lot of us were involved in that campaign to support them, and through the OFL, et cetera. And I think we need to build up and we need to work with ONA. And I guess my question is, how can we, who else are you working with in ONA? I know there's OCHU, and I'm in touch with them to some extent, Ontario Council of Hospital Unions, CUPE, there's SCIU, there's OPSU. Is there any coming campaigns and plans so that we could actually be your supporters on the outside and we can work with you? And I know you don't have the right to strike as they do in the UK, which would be the most powerful weapon, but do you have any possibility of job action? And again, something that we as the public can support you. Thank you.
Right, thank you. So great, and I've actually seen that question in the chat here as well. So yes, ONA has planned an all-out picket on Thursday. I know the weather isn't sounding great for our areas anyway, but we're going to do it because people have been in strike positions all over this province in all kinds of inclement weather. So it's not going to deter us. We are going to be out. We have a whole campaign site off the ONA website about our all-out pickets. You can go there and you can see if there is a picket close to you on the 23rd. There are different times depending on when the organizers could get the picket set up for their area. And we have received so much support from labor partners such as the Ontario Health Coalition and the separate councils. Peter has been a great supporter of mine over the last year or so that I've been doing that and gotten to know him with other things that we've been at. And we have a number of labor councils that are supporting the individual hospitals where the pickets are going to be. So I would urge you to go on our website. It's right there in the chat. Thanks for putting that up. And you can actually access and see where there is a picket. I am unsure, but when I'm done talking, I'm going to message the bargaining unit president in Haliburton and see if he's doing a picket there, if he has enough people to help him, because they are unfortunately one of our hospitals that is in a staffing crisis. It's a little more severe than others. So we know that it could be just not possible for him to be doing that on his own. So I will find that out and I will drop it in the chat if I know what's happening. This is the first picket that we're having. These are information pickets. We are covered by a law that uses mediation arbitration to settle our labor disputes in the hospital sector. It's a protective measure, of course, to keep patients safe. But we have so many members that are so fed up. They are so done with the way they have been treated and are being treated. And they are going to come out to these pickets. They are going to magnify their voices and they are going to tell the government they need to stop doing what they're doing. They need to start paying nurses and healthcare professionals wages that will respect their worth in the workplace, because they have felt very disrespected with Bill 124. After February 23rd, next week on Thursday, we are having an all-out picket in Toronto at the Sheraton where we are doing our negotiations. I will be negotiation. I have the luxury of doing that because I am an ex officio member on the negotiating team, and I will be coming out to see the thousands of people that are going to be there on the streets of Toronto in front of the Sheraton at 123 Queen Street. They are going to be there supporting us, and they are going to be loud. And I urge you, if you have family or friends in the area, if you can ask them to come and support the nurses, that would be great. There will be many labor partners there. There will be many unions there. We've been reassured that they will come. So build it and they will come. So that's what we're doing. All the information is there on the website.
Bart, do you have your hand up for another question?
Yes, I do. Just to follow up on that point, is there, for those that are unable to attend in person, is there also something available on that website for which, some other means of support is outlined?
Yes, there is. There's actually very quick links where you can go on that website and you can send a message to your MPPs or across this province and tell them, demand that they support nurses.
Thank
So
you.
I'm conscious of the time. Does everyone know how to put up their hand if they did have a question? A couple people have put questions in the chat and some of those have been answered. If you go to reactions, if you're not familiar, you can just click on it and you can put up your hand. Otherwise, we'll just wait for a few minutes to see if there are any other questions, and if not, we'll move on, but I'll give people a chance. I could have said that earlier. I'm just so used to Zoom, I guess I assumed that everybody might know that. So if anybody does have any other questions? No? Okay, well, thanks again, Bernie. Your wealth of
Thank you,
knowledge,
everyone.
and I really hope that all the actions that are coming up in the near future bring out a lot of people, because that's what we need. We need to build awareness and we need to build action. Anyways, our second speaker for tonight is Natalie Mera. Natalie has been the executive director of the Ontario Health Coalition for more than 22 years. She has built the Health Coalition into the largest and broadest public interest group on healthcare in the province, representing more than 750,000 Ontarians in its network of more than 500 member organizations and more than 50 local chapters. It is truly a privilege to work with Natalie, her staff, and the other amazing cross-province leads on the local coalition committee I sit on. Natalie is a powerhouse of passion and leadership. We welcome Natalie tonight to our Haliburton County Town Hall to share her wealth of knowledge about the impacts privatization of our public health care system and our hospitals will have for all Ontarians and could have in Haliburton County as well. Welcome, my friend.
Thank you, Bonnie. And it's really lovely to see all of you here. I love your area of the province and really thrilled that you are working with us on this. I guess I wanted to start with a story. It comes from a book called Life Before Medicare. And it was the book was pulled together by the Ontario Council of Senior Citizens Coalitions, the Ontario Coalition of Senior Citizens Organizations, sorry. And it contains stories from people in Canada of what life was like before we had public Medicare. And one of the stories just has never left me. You know, it was maybe 30 years ago when I read this, but it was about a woman and she had cancer. And she was a farmer. She was in a farm family, and she didn't want to bankrupt her family when she was dying. And so she asked them to lock her in the house and not to seek medical care when she was dying so that they wouldn't lose their house and they wouldn't lose the farm and her family would be okay. And oh, it makes me cry to think about it, sorry. So I think this story was, if I recall correctly, was written by her daughter. And her daughter recalls her mom screaming in pain as she was dying in the house without medical care, medical treatment. Because at that time, if you didn't have a way to pay the doctor, you couldn't get care. When we won the Canada Health Act in Canada, what we won was a prohibition on billing patients when they need care. You cannot in this country legally charge a patient for medically needed hospital or physician care. It's banned. And so the idea was, as Justice Emmett Hall said, and he was a appointed by Diefenbaker. He was a conservative judge. When he recommended the Canada Health Act, he said, you know, the Canadians have decided that we would band together and we would pay for medical care through our taxes, so that when we were old, when we were dying, we wouldn't face financial ruin at the point when we needed care the most. I think that is a defining quality in Canadian life. Sorry, I'm emotional because I've never been so scared that we're going to lose it. You know, a couple weeks ago now, after the Ford government announced their plans to bring in private for-profit clinics and hospitals, I was speaking on Messenger with a woman who was telling me a story about her friend in Saskatchewan. He also is a farmer. Here we come full circle. Now it's 2023. He was told that he couldn't get his hip replacement surgery in the public hospital system, or he'd have to wait a year or maybe 2 years for his surgery. Now, who knows if that's true, because they were referring to a private clinic and people don't know. I mean, they don't have a way of checking that information. And we know the private clinics often manipulate patients into paying for things. Anyway, so he could go to a private clinic in Calgary to get his surgery, but it was going to cost, get this, $50,000 for a day surgery, hip replacement surgery, which by any stretch of the imagination is a ludicrous price. And then he was trying to figure out about, you know, whether or not he could raise money to pay for this hip surgery. This should just never happen in Canada. It's illegal. One, it's illegal for the private clinic to charge the patient. Two, you know, the provinces have received significant increases from the federal government. And, you know, a number of these provincial governments, like Ontario's, are literally driving the public hospital system into the ground in order to feed the privatization of it, because Canadians don't want to see our public hospital services privatized. They don't want to have to pay for medical care, and they won't unless they absolutely just cannot get it any other way. And increasingly, that's what's happening. So I'll tell you a little bit more about that in just a moment. But I wanted to, I think one of the biggest challenges we face is that we have lived for an entire generation with public Medicare in this country, and we tend to take it for granted. We tend to think that no politician will actually ever take it away. And we tend to not really realize the extent to which there is a for-profit industry out there, you know, made up of private equity firms and financial investors and so on, who see the public hospital system, for example, as a multi-billion-dollar system from which they want to take their profits. And their model of care, their business model, is to charge OHIP. They don't want to get rid of OHIP. They want to be able to bill OHIP or the equivalent in other provinces and bill patients on top. That's how they maximize their profits. And they're doing it increasingly in our province and in the other provinces where they have actually allowed the private clinics and hospitals to move in. So I wanted to bring a warning. As Bonnie said, you know, in all of our communities across the province, we have literally spent 100 years building up our local public hospital system, only to see in the recent, you know, decades that they have been endlessly downsized and cuts, even while community members volunteer and donate through payroll donations and raise money and do everything they can to support those local public hospitals, government after government. And we're not partisan. I mean, we just tell you the truth and you decide how to vote. That's not our role. Our role is to protect public health care, but we have to stop them from endlessly cutting and robbing from our local public hospitals. As Bernie described right now, the staffing crisis in the hospitals is nothing like anyone has ever seen before. It is the worst it's ever been. Today, if you get the Toronto Star, I was interviewed in a story that's in the Toronto Star about the number of emergency department closures that we've had over the last year in Ontario. 158 emergency department closures, temporary emergency department closures in Ontario because the hospitals didn't have enough staff to run their emergency departments. Can you imagine this? And it's hard to imagine a government doing less about the staffing crisis than this government has done. And that is just objective. I mean, I can't, in all of the years I've been on the board or the executive director of the Health Coalition for 27 years now, I cannot imagine any government tolerating more than 100 emergency department closures because they don't have enough staff to run them. Closures of maternity departments, birthing in the local hospitals, closures of ICUs. I mean, these are the most urgent types of care that we have in our hospitals. And yet really nothing is happening. As Bernie has talked about, the government actually brought in wage suppression legislation, which has existed throughout the pandemic, even as the staff literally risked their lives to care for us. And now that they have lost in court, they're actually using our money to appeal to bring it back in. It's just astonishing. In addition, they've held repeated press conferences saying that they're going to fast track international grads for nursing and health professionals and so on. But really, it's really been about a handful. It's been about 1,000 staff, I think, over the course of the last year. And even if they did them all, it still is not anywhere near what we need. What we need is what Quebec did after the first wave of the pandemic. For the PSWs and long-term care, for example, they did a mass recruitment. They paid them $21 an hour to train them. They did an intensive training. They increased their pay to $25 an hour, and they got them into the long-term care homes, almost 10,000 of them, in time for the second wave, and they saved lives. They had a far better second wave than we did. We actually lost more people in the second wave in long-term care than we lost in the first wave, which was devastating. And at this point, the staffing crisis in long-term care continues. Obviously, for nurses, it takes longer to train them. So the only way through this is to bring back the nurses who've left, who've retired out or voted with their feet and are, through burnout, through just inability to cope anymore with the endless increasing demands, the impossible workloads, from being called in, to do overtime every minute that they're off, and knowing if they say no, that they're leaving their colleagues short-staffed. I mean, this is not, it cannot go on like this, and yet nothing is being done. And now we see the plan. About a month ago now, the government announced that they were moving forward with bringing in private for-profit clinics and hospitals. I'll just give you their wording, just so you get the scope of this. They said that they will, quote, significantly expand the privatization of surgeries and diagnostics and private hospitals and clinics. They have called for bids for 3 new private day hospitals to do 14,000 cataract surgeries initially, as well as diagnostics. They're giving $18 million in new funding on top of an earlier expansion of their funding to expand existing private clinics to cover care for, quote, thousands of patients, including 49,000 hours of MRI and CT scans, 4,800 cataract surgeries on top of the others, 900 other ophthalmic, that's eye surgeries, 1,000 gynecological surgeries, 2,845 plastic surgeries, and so on. They're expanding the number of private clinics, and they intend to further expand the volumes as well as the scope, the types of surgeries that they privatize. They plan to have private hip and knee surgeries up and running by 2024. So I give you all those details just so you get the scope of what they're talking about. When in the question and answer session, the media scrum, Ford said that their government's assessment is that 50% of the surgeries in public hospitals are the ones that they deem to be the, quote, the easy ones, and thus the type that they would like to privatize. Well, when we think through the hospitals in every medium-sized town and small town, that's all the surgeries that are pretty much left in those hospitals. It would gut those hospitals. The day surgery, the fast-track high-volume day surgery centers, essentially day hospitals that they are initially building, will take all the volumes for the region. So, for example, the one in Windsor will take all of the eye surgeries from Chatham and Leamington and Wallaceburg and Petrolia and Sarnia and so on, and centralize them into that high volume center. They take only the easy surgeries, the profitable surgeries, the ones they can make money from, the patients who can walk in and out, and very quickly they can do the surgery, leaving the expensive surgeries, the complex surgeries, the people with diabetes, with COPD, who might be overweight, who are high at risk for coding on the operating table, et cetera, they leave those behind for the public hospitals with less staff and less funding to provide the care for them. And, you know, the trick is this, the light and easy surgeries are subsidized the heavier care surgeries in our public hospitals. This would be a devastating plan at any time in Ontario. With the current staffing crisis that we have, it will gut the hospitals. I don't know how we will be able to maintain many of the middle-sized and smaller community hospitals in the province if they do this. And of course, when you lose the surgeries, you lose the surgeons, you lose the doctors from the community, and you end up in this kind of vicious spiral, which we've seen in towns where they've closed down the smaller hospitals. It's devastating to the local health system. And then just to get back to where I started from, we have called, some provinces have allowed this to happen or have brought it in to some degree. In British Columbia, they've brought in private clinics. In Quebec, they've brought in private clinics to do day surgeries. In Alberta, they've done it, and they've started in Saskatchewan and Manitoba. We have 4 times over the last decade and about 12 years called every private clinic in Ontario, and twice we called every private clinic in the country. We said that we were a patient, that we wanted to get, say, a hip surgery, whatever it was that they were selling. We said we wanted to jump the queue. Could we pay to get the surgery faster? How much would it cost? And so on. We caught the majority of them, not a small number, the majority of those clinics, extra billing patients. So charging patients directly for their surgeries and diagnostic tests. And the prices are outrageous. I mean, 10 times the cost of the public system for a shoulder surgery. And it's illegal, right? As I noted from the top, it's illegal. You're not allowed to do that in Canada. But the private clinics have a plan, which is to just introduce the facts on the ground, put it into operation, challenge provincial governments to catch them. And if they catch them, then they might stop for a little bit and then bring it back in. Or as in the case in British Columbia, they've brought a legal challenge to bring down the laws that prohibit extra billing patients and protect patients against user fees. They're trying to bring down single tier Medicare in this country. They've lost at every level of the courts in British Columbia. They've now appealed to the Supreme Court of Canada. We're waiting to hear whether the Supreme Court will hear the case or not, but they want to bring down single tier public Medicare. The prices for cataract surgeries, which we now see in Ontario, where we have cataract surgery private clinics, they're charging $2,000 an eye for cataract surgeries. They're charging patients all kinds of medically unnecessary add-ons, $500, $200 for an extra eye measurement test, which is medically unnecessary, but they don't tell the patient that. They commingle, they charge for extra lenses. They tell you need them. They tell you that they're the Cadillac and the OHIP way is the crappy old way, or things like that. Patently untrue, things to manipulate people into paying extra. In some cases, they do give actual accurate information. They'll say the lens is a different lens. It does something different. You don't need it. But most of the time, they try to persuade the patients to pay extra. And the reason is this: if you have 1,000 patients a year and you charge $200 extra for an eye measurement test, you're making $200,000 a year. If you charge $2,000 for their cataract surgeries, you're making $2 million extra a year. And that is what's going on. We don't have private hip and knee surgery places. We still have public hospitals that provide the vast majority of surgeries and diagnostics in Ontario. Where there are private MRI clinics, we're starting to see charges move in. Mostly they're in other provinces. They're charging $1,000 per MRI scan to start, something that under OHIP, when we try and ramp up the MRIs in the public hospitals, will cost $280 to $350 a scan, literally a quarter to a third of the price. I mean, this is a way that will increase healthcare costs for everyone. It will mean that the wealthy jump the queue, and those who can't afford, the elderly, people on fixed incomes, people who can't afford to pay, will be left behind waiting longer in the public system. And that is exactly what's happened in those provinces. Mike Harris, when he was in office, I think many of you will remember, they privatized home care, and it's been a disaster ever since. They privatized a for-profit company's long-term care. The majority of long-term care now, 70% in Ontario, is privatized. And we all saw what happened during the pandemic with these for-profit companies. Now they're coming for the hospitals, and I don't want to lose our public hospitals in this province. We need to build a fight back that will force the government to actually resource and support our public hospitals. We can afford it. Ontario funds our hospitals at the lowest rate in Canada by every measure. We have the fewest hospital beds left after decades of downsizing of any province in Canada by a long shot. We're 14,000 behind the average of the rest of the country. The only countries in the OECD that have fewer hospital beds left than Ontario are Chile and Mexico. There is no question we can afford to support our local public hospital system, rebuild those services, open up those closed operating rooms in every hospital across Ontario because they don't have the funding to run them. And now they don't have the staff to run them. We can absolutely clear the backlog of surgeries and diagnostics if we only could have a government that would resource our public hospitals. So we need to force this question into the public domain. We need to get people of every walk of life in every community to speak up, to protect our public hospitals, to force the government to fund them adequately and support them to provide for our needs, or we will lose single-tier public Medicare in our province and our country. I'm asking you tonight, will you join us to do that? The first step for us is they've introduced new legislation today. I haven't even read it. It's 144 pages. It amends all kinds of pieces of legislation. I'll try and go through and analyze it tonight. We'll fight that, but obviously they have a majority. They'll pass that legislation. They changed the rules of the legislature so they could pass bills quicker and limit debate in the legislature. So they're going to get it through within a few weeks, but we can stop them from implementing it because we can just make it politically impossible for them to do it. So we want to hold a referendum, a citizens called referendum across Ontario. We want to get votes outside corner stores and grocery stores and coffee shops and drugstores and so on in every community across Ontario. We want to ask people to vote en masse. Do you want the government to support our public hospitals, or do you want them to privatize to for-profit hospitals and clinics, our public hospital services? And we want to give people the opportunity to actually have a say. We want to make it visible, impossible to ignore. I think we could get 1 million votes in this province on this. In workplaces, we'll ask Bernie and the hospital unions and others, the health professionals and so on, will you carry ballot boxes through the hospitals and get votes among the workers in the hospitals? In the industrial workplaces and private businesses in our community, we'll ask the same. Can you hold workplace votes for the last 2 weeks of May? Could we do online voting as well? Could we print a ballot in the local newspapers so people can mail it in so we can maximize the vote? We'll ask everyone to sign a pledge with their postal code that they'll only vote once to try and control, to make sure that, you know, it's a legitimate vote. Could we ask retired MPPs or MPs, lawyers, judges, teachers, municipal councillors to help count up the votes, you know, publicly with scrutineers in your community to help count towards the total? We're proposing to hold the vote on Friday, May the 26th and Saturday, May the 27th. So busy shopping days to have the on the street votes, the workplace votes for the 2 or 3 weeks leading in, online voting for several weeks leading in the community colleges. Could we do it before they leave for the break? So before they have exams and so on. So that would be late March, early April. We'll produce a door-to-door leaflet. Can you work with Bonnie to find voting stations if you know people who own local businesses, or you have a corner store that's busy that you often go to, etc.? Can people help to get ballot boxes? What we were doing was using liquor store boxes, you know, for ballot boxes. I'll show you a very quick video before I end to show you kind of what this looks like. We did it before very effectively. And really, there's a role for everyone. We're not asking for 24 hours a day, but just can you help to do what you can do in this campaign to try and make it visible and to try and stop the privatization. And so, sorry, just to end quickly and show you a video clip of what it looks like. We did this when the government tried to bring in a model of privatization called public-private partnerships. It's kind of halfway between privatizing the hospitals fully and what we have now, public hospitals. Sorry, I'm losing my voice. And we did it in 8 towns. We got 198,000 votes in those towns. And the government actually rolled back very, very significantly, almost the entire privatization of services in those deals. They're still not good. They still privatize the finance, it's too expensive, et cetera. But the hospitals and their services remained public. We were able to do that through that. So we did a little video, actually we didn't, one of the unions did, and it shows what it looked like on the ground there. I just want to show it to you quickly, if you don't mind. Bonnie, is that okay? So people have a little bit of a picture, and then open it up for questions and answers and discussion. This is literally 3 minutes. So here it is. Okay, all good? Okay, I'm gonna do it just 1 sec. Sharing my screen. Sorry, I have to find the video. 1 second. Here it is. Sorry, I just have to move around the extra stuff a little bit, and here it is.
This looks very much like an election campaign, except it's not. It's a plebiscite vote that's actually citizen-run, not government-run. It's put together by the Ontario Health Coalition, asking citizens if they want a public or private hospital.
Well, the drivers have extra ballots, so if they need more, like if they've run out in their trucks, then I will let them know you guys have some extra.
The phone's been nonstop. People are interested. They want to learn more. They've been very supportive of the campaign. We've had very little people coming in upset about what we're doing.
Well, we're holding a community-wide plebiscite, which is a community-wide vote, like a referendum, only it's organized by a citizens group, by the Kingston Health Coalition, about the future of the new hospital in Kingston, whether it's going to be a public, not-for-profit hospital, or whether it'll be built as a P3, privatized P3 hospital with 30-year-long contracts with a private for-profit multinational consortium.
Some people wonder how this affects healthcare. They say, well, the healthcare system remains public because nurses and doctors will be paid by the government. But the model of the P3 hospital is a step in quite a dangerous direction.
Some of the more conservative members of council have tried to argue that we shouldn't have any role in it as municipal councillors because it's a provincial issue.
So we're very concerned in the city of Kingston about where is the money from our property taxpayers going, and it turns out that it's going to fund a consortium that over time will make 12% on their invested money. So that 12% is, part of that 12% is coming from our property taxpayers.
It's been really positive. It's actually really cool. People are pretty excited, especially when they hear that there's 180 other volunteers out there on the ground doing this as well. It's just such an incredible feeling of solidarity. Everybody, even though they've been out there in the cold for an 8-hour day, they have no problem doing it. They're having fun and having a great time.
It's been very hectic, super hectic. We had 3 volunteers here for most of the day, and we barely had a chance to have a drink of coffee, and we're right here in Tim Hortons, so that just goes to tell you how busy we've been.
All the businesses have just been so warming and welcome to allow us to be able to set up these poles. It's been a great commitment by the businesses here in Kingston.
It was a huge victory, and you talk to people on the street, everybody knows what's happening. It's now become a public issue, and it wasn't 2 months ago. Nobody even knew we were getting a new hospital. So we've elevated the debate and the public sort of discussion and the democracy around this healthcare policy to a level which is phenomenal. That's the value in a sense of validating that whole discussion, all that work that was done. And then as the next step forward, we're going to be able to say to the government and the politicians, you know, this community really cares. We want a public health care system.
So that's what it looks like. That's what we're proposing. And I guess I'll just end with this. You know, we have to provide a way to raise people's voices in no uncertain terms, to make it impossible for the government to go forward. A large petition in Ontario has 30,000 signatures. There's almost nothing in politics that happens where we get 1 million people to do one thing. It would shake any government of any political stripe. I believe that the mass of Canadians, you know, no matter which party you vote for, supports our local public hospitals and wants to keep them vibrant, wants the services restored that have been closed down, wants to ensure that those services are there for our communities. I think the vast majority of Canadians believe that healthcare should be provided based on need and not how wealthy you are. Believe that it should be a public service operated in the public interest and not for private profit in private interests. I think those are values that we hold dear as a people, and that we can actually mobilize something that could make a huge difference here if we all work together. And so that's my appeal to you today. Thank you very much.
Thank you, Natalie. Terry, did you want to do a quick thank you before we do the Q&A? Nope, can't hear you.
Can you hear me now?
Yeah.
Okay. Wow, Natalie, so much vital information. On behalf of the Haliburton Long-Term Care Coalition, I would like to thank you for taking the time to speak with us tonight about this very important issue and the real danger for its negative effect on a system struggling to provide adequate care to all the citizens of our province. We appreciate the tremendous amount of work you do for betterment of the healthcare system in Ontario. Thanks, Natalie.
It's a collective
well,
effort.
I told you she's a zinger. Anyways, any questions for Natalie? I'm conscious of the time at 7:30. We have time for questions and then a wrap up about how everyone and anyone can get involved in any small way. So I'll open it up to the floor. I'll try and keep an eye on the chat too.
Bart has his hand up, Bonnie.
Oh, there you are. See, I keep missing you because I'm looking down. Bart, go ahead. Sorry.
So I'll try to make this the last time that I take the floor because I've already asked 3 questions. But the notion that I hear with regards to a privatization scheme in healthcare is that it would inject both innovation in the space and competition in the marketplace, and presumably those things in an ideal setting would drive the cost of healthcare down and standardize the delivery of healthcare services to a particular level. And you know, whether or not that is an idealistic truth rather than an actual truth, why is it that the way private healthcare has manifested itself in Canada so far has become like predatory in the sense that it bills so substantially high relative to what the public system can deliver, rather than being competitive with the public system, if not costing less, to try to outcompete the public system in terms of performing the service at a comparable or less cost. Thank you.
Yeah, so it's a good question. Well, it's not just in Canada. I mean, it's everywhere where they've brought in private healthcare. But I mean, worse here in a way, in part because there's only one labor force, right? Like a nurse is a nurse is a nurse. There's too few of them. Same with an MRI tech. If you open a private clinic, you take the MRI techs that are in the public hospitals. There's no surplus of them, right? When they brought in private for-profit home care, they said the same thing. Well, competition, innovation. The innovation was that they took their profits by lowering the wages and working conditions of the workers. In home care, there's almost no overhead. The cost is the cost of labor. Same in most of healthcare. It's a human service. The cost, most of the cost is the cost of labor. So the for-profits, you know, took their profit by lowering the wages and the working conditions of the staff. Staffing shortages ensued and have been in place in home care ever since they privatized. And really, you know, well, I guess the other innovation was they had to turn care into bite-sized widget-like chunks. You know, originally it was an hour visit, then a half-hour visit. Now they're 15-minute visits, literally, in which the PSW goes in and cleans the privates of someone and gets out to go on to the next one. Because in order to bid for volumes of service, they need to have a comparable volume of service. So it fundamentally changes, you know, the type of service. In hospitals, the issue is that having multiple hospitals that are competing with each other splits the workforce between multiple sites. You have to buy multiple operating rooms and multiple sets of equipment and all of that sort of stuff. That's why in the US, the private hospital system is so expensive. And then in addition, you've got to make room for profit. And if there is any innovation, they have no interest in turning over any extra money they make from innovation to the public. They take it for themselves. And mostly the innovation is around how to save money on expenses in order to maximize their profits. And so when you look at the big meta-analyses, the big studies of for-profit hospitals versus not-for-profit hospitals in the United States, for example. So these are studies that cover every study that has been done. They literally look at millions of patients and thousands of hospitals. They find a very significantly higher death rate in the for-profit hospitals than in the public and not-for-profit hospitals. Why? Because they skimp on staff. In the for-profit dialysis, hemodialysis clinics, again, the big meta-analyses, so these are the private clinics, find a much higher death rate. Why? Because they push the blood through the machines faster to get more patients through faster to maximize their profits, or they clean the blood less because they have lower trained staff so they can pay their staff less, et cetera, et cetera. Like the innovation is to maximize their profits, not to provide the best care for patients. That is certainly what we see in long-term care in Ontario, where the innovation has been to reduce the numbers of staff in the for-profit long-term care homes, to oppose regulations like regular surprise inspections, enforcement and fines against those homes that have poor quality and so on. They have opposed those. We've never been able to stop them. You know, we win inspections, you know, then the Ford government takes them out. We win them back again, then they delay them for 2 years. We still don't have even annual surprise inspections back in long-term care homes because the for-profit industry opposes them. So that's how it operates. It's actually more expensive, not less. It takes staff away from, I mean, there's only one set of staff, even in the United States where they have lots more than we do, population, and they don't have the same kind of population distribution that we have, where we have, like in Ontario, you know, a province that you could fit 5 countries in Europe in, and we have to provide healthcare for the mass of people across the countryside with low population areas, as well as large urban centers. You know, we have a much more extreme kind of population distribution, but privatization for the smaller towns would be even more devastating. I mean, it's not a good model for a city. It's a terrible model where you're taking staff and resources and funding and the procedures out of the smaller communities.
Appreciate you answering that. And that is a point I think that has to be emphasized moving forward with respect to the idea that privatization brings about innovation and lowers the cost, but stabilizes the quality. So I appreciate that. Thank you.
Thank you for the question. Gail has her hand up, Bonnie.
Yes.
Gail, you have your hand up? Sorry.
Yes, I do. You mentioned materials and things like all these signs and handing out pamphlets and everything. Is that something that we can get up here? And because in sitting here listening to this, I'm thinking to myself, you know, the average person really just cares about if they're sick or they want something done and that they're going to go and get it. And a lot of baby boomers, you know, we've done very well. We have pensions. And so they go ahead. They don't look at how it is that you can get that. They're not looking at the very core of what you say here is that there are only so many healthcare providers. And if they all move to privatization because of the fact that they pay more, then, you know, we are totally messing up the system. So it's almost like you have to be prepared to stand up and make some self-sacrifice at sometimes in order to better it for everybody. So I really hope we'll get some materials up here because I'll be spreading them around and I'm going to start talking to everybody I know about this.
It is sort of like that, but I mean, the other truth of it is that literally every public hospital in Ontario has operating rooms that are closed in the evenings or weekends or for weeks, months, years, even permanently, because they have cut the public hospitals that much. They literally doubled the funding for the private clinics.
Yeah.
Like, it's not like they're doing it for free, right? They've just shifted the funding from one place to another. If we just funded our public hospitals to do those services, we could get those services. And I think that's what we should be demanding. And, but so, I mean, I totally agree with you. For the materials question, which was the core of your question, yes, absolutely. So we're gonna have the materials ready. Well, we'll have finished making them by the end of February, so beginning of March. What we were going to propose is that for each area, no speeches or anything, we just do one big Zoom meeting like this, but for each region, kind of walk through the organizing and make sure that we have a key contact in every town that we can. So we could at least get 1 or 2 voting stations, be it in a Legion or a store, what have you, in every small community that we can. Identify who those people are, walk through the plan and like who's going to distribute materials to people in each place and so on, and then have in-person meetings in which you get like ballot boxes, ballots, leaflets, et cetera, at the beginning of April. And then we start to go door to door in every community meeting. You know, we have the leaflets. Hopefully by then we have voting stations so we can put an insert into the leaflets with where people will be able to vote in May. We try and cover the entire community and get volunteers as well at the same time to hold the vote at the end of May. So it's going to take just that period of time, March and April. And then in May, we want to start to have the votes rolling out. So my idea would be that we do one kind of Zoom meeting like this, online meeting, but with the whole region. So Kawartha Lakes, Haliburton Highlands, Peterborough, like your whole region, Northumberland. Walk through very concretely. This is in a few weeks in March when we have the materials ready. Walk through how to do it, set up a date to get together, say in Haliburton and say in Minden, or, you know, in the various other towns in between, Dwight, I mean, wherever it's possible, and roll and then actually distribute the physical materials. Between now and then, the part locally that you could do with Bonnie is help to find voting stations, go to the LCBO and get boxes and cover them and make them like ballot boxes that we could use, because you're going to need several hundred of them to get out for the voting stations, kind of figure out, you know, get as many volunteers as we can get going, try and make connections with people in workplaces and so on that would do workplace votes. And then we'll be ready to really roll it out on the ground in a few weeks. So late March, about a month from now. And then distribute the actual materials in person in every town at the beginning of April.
Okay, great.
Are there any other questions for Natalie? I have a whole list of how you can get involved, Gail.
Okay.
I will follow up with Natalie. But before I do that, I just want to make sure I'm trying to see who has their hand up? If anyone.
Pamela has her hand up.
On to the next, where's Pam? Pam, go ahead. How come I can't see that?
You're on mute, Pam. Should be the bottom left. There you go.
Okay, can you hear me? Everybody?
Yes.
Okay, I don't want to, diverge away from what we're talking about right here, but I just wondered whether people are aware of what the Ontario Federation of Labor is doing. They have a huge, huge campaign going on. It's called Enough is Enough. And, they're doing things like what you're talking about. I think the voting is a wonderful idea, and I'll certainly be there to help that in any way I can. But, they are planning a provincial day of action. I believe it's either June the 3rd or June the 5th. So it's very close to the dates that you're looking at. And it might be worthwhile just to reach out and see if there's not some way that, we can get some help from them and perhaps give them some help too. Because I mean, there's many things. Healthcare is huge, of course, but there's many things going on in this province that none of us want. So why is it happening? It's happening because he doesn't have a majority. It's happening because we had the lowest voter turnout in the history of the province. So everybody who wanted Doug Ford went out and dropped their name in, and the rest of us, well, not me, but the rest of us sat back and did nothing. So, they say you get the government you deserve. So I don't believe that. I think that people need to be motivated and inspired by others. And, anyway, I just wanted to mention that initiative that's going on as well.
Great point, Pam. And James Mulhern, whom I'm in contact with constantly, I'm aware of that event you're talking about. He actually sent out our invite to his Federation of Labor. So we do work together, and I have gone to some of his events that they hold in City Porth Lake. So great idea. And I will be following up with you for sure, because you always have great ideas. So does anybody else have any other questions for Natalie? I know that was a lot to hear, but it makes so much sense to me. It makes so much sense. So I don't see anybody on my first screen. I'm looking at my second screen. A lot of people seem to have their, Bart, are you back up again?
No, he's clapping.
You're clapping. Okay.
So you were going to ask for volunteers, and I just, Bonnie, if you don't mind me just stepping in. So for people who don't know, because you're not used to Zooms, if you move your cursor at all, a toolbar, if it's not already showing, will appear along the bottom of your screen. And in the middle, it says chat with a little balloon icon, like a speaking balloon. So if you click on that, you'll be able to indicate in the chat if you're willing to volunteer and the kinds of things you might want to do or what town you're in. We have your contact info because you registered, so you don't need that. But as Bonnie's talking, if people can indicate that they want to volunteer, and if you're from a particular town, identify which town you're in, I think that would help. And I'll leave it to you, Bonnie. Sorry, Rachel has her hand up. And and Peter, there you are. Sorry. But I think Bonnie wanted to ask for particular things as she's trying to get this organized.
So does anybody have any other questions specifically for Natalie, Rachel, and Peter? Or is it about how we're going to mobilize ourselves? Because I do Natalie's been speaking to some of my talking points, so I'll just move forward. So Peter, what did you have a question for her specifically?
Well, I'd like Natalie to hear my point and maybe be able to answer it. And it's fairly simple, really. I just wanted to, I want to thank Natalie for the great speech, and Pamela, you raised a good issue. And I saw you at the Enough is Enough training for the OFL. And my question is fairly simple. One of the demands of the Enough is Enough campaign launched by the OFL, and this is because a lot of us rank and file trade unionists said, we got to mount a campaign around inflation, the rising prices. One of the demands is around privatization. So it really dovetails. But I think one of the problems that I see, and that will affect myself and yourself, Pamela, is that we're involved in both campaigns. So I guess my question for Natalie is there a possibility of the Ontario Health Coalition working very directly with the Ontario Federation of Labor, because we don't want people being torn in two directions. We need, the campaigns are very similar, the demands are similar, the OFL campaign is bigger, but we can't be doing two things at the same time. You don't want to burn people out. So there needs to be some coordination at the top so that the OHC campaign dovetails with what we're doing in labor. Thank you.
So just to answer that very quickly, Bonnie. The Ontario Federation of Labor, we have been in touch with them, and we're a community group. We're not the labor movement, but we have been in touch with them, and they are supportive. They've said that they would support. They know the dates. I did not know that they were going to call a day of action for the weekend after. There's nothing we can do because the legislature rises June the 1st. We need the time that we've got in order to be able to actually organize this and get 1 million votes. So that is what it is. But they have said that they would support the movement. I mean, obviously we're on a timeline here. They're bringing in the first 3 private hospitals. If we don't stop them, we'll have lost the hospital. So we don't have a year or 2 years or anything like that. We have to move now. But yes, they've said that they would support, and obviously, we support, social justice and things that are good for people generally, and so we'll support in whatever way we can. The fight back against inflation and the environmental issues and all of those sorts of things, or really it's not inflation, it's price gouging, but all of that. So the simple answer is we can't really change the timelines. There's just no way to do that. And so we'll do it through local health coalitions and key contacts in every community. If the local labor councils are doing the day of action for the Enough is Enough campaign, then that's great. And if they can help in any way in getting workplace votes happening. So, I mean, really, what are we asking people? Well, in workplaces that are unionized, would they hold a vote in the workplace in the last 2 weeks of May? They may then at the same time be signing people up for buses to go to a day of action, or be helping to organize a protest a week late, in June. I don't think that is insurmountable, and then much of our membership is not the labor council or organized labor, so it's a mixture of community and labor. I think we should be able to do it.
Okay, Pam, under Rachel, I mean. Hi,
yes,
Pam.
Thank you for acknowledging. Thank you, Bonnie. Yes, I'm using Rachel, and we're both watching under her Zoom today.
Thank you so much.
I just want to make a comment about strategy and issues, and how to, in addition, on how to achieve where we're going. Your municipal councils have the opportunity twice a year to meet with ministers. One at the ROMA conference, Rural Ontario Municipalities Association, that takes place every January. And the second one coming up is the Association of Municipalities of Ontario. Delegations can be put forward from every municipality to come forward and speak directly to the ministers and raise these kinds of concerns. We need to encourage our municipal and governments, and those councillors who are not familiar with these issues need to become more familiar with these issues. And I want to just point out that our warden, Liz Danielson, is online here too, which was really great to see. And I think we need to use that strategy and make sure that our councillors are going to these ROMA and AMO meetings and are having those delegations. I know we had over 300 delegations on various topics, a lot of it doing with homelessness particularly, but on this issue as well at the ROMA conference in January. So please, this is a provincial issue. It needs provincial change, but we're sitting at the municipal seat in order to bring these things forward too. So we need all the municipal councillors to be informed of this. So thank you. I just wanted to raise that. Thanks for the opportunity, Bonnie.
Perfect, Pam. And thank you as Councillor Minden Hills. And yes, and I was going to mention that I noticed that our warden is on the call or on the Zoom call, which is amazing. Okay, are there any other questions? Natalie, do you have your hand up? Or you're saying a thumbs up? Yay. Okay. I think it's my lighting. The lighting from my above light here is really reflecting. I'm not seeing it properly. Yeah, well, is there anything else? I see people who have volunteered. So I'm just going to close, do a few wrap-up points here. So Natalie, with her usual zeal and impeccable detail, outlined the process for the upcoming referendum. And I know that together we can do this. We did it last year when we were putting up signs for privatization. You probably saw them all over the county. Some people still have them up, and I encourage everyone that we have more if you want to put them, if you want to get some now. And definitely if you've taken them down, this is the time to put them back up. So as I say, I think we can bring together a huge team, and together we can make this work. So again, sign in the chat if you want to help. I've been taking people's names as I said that, or if you want to just email me personally, that's fine too. So some of the tasks we can start, we already started tonight by we took this first step by coming together. You showed all of us that in Haliburton County that you do care about privatization of our hospitals and our healthcare. We can start now by actually, because we're going to need so many wine boxes, this is a simple thing. You saw what Natalie showed. We can start going to our LCBOs and asking permission. They do have sections where they allow you to take them with permission. We can start collecting them because I know we're going to need a lot. We're going to need red duct tape. So I'm going to start collecting some of that. We can start wrapping some of those boxes. Natalie showed that they did it with brown paper in Kingston, and then again made a slit. We can start thinking about potential businesses, community groups, legions, libraries, even our high school, again, our nurses, all of these different people who might support us and be a polling station. I've already had 2 people agree in Haliburton County. And as soon as the words were out of my mouth, because I talk when I'm in these stores with some people, because they raise political issues with me, because they know I'm so involved, and they're right on board. So I know we can get a lot of people who will support us and make this happen. And we need it all over the county, all over. And once we get the toolkit, we can start looking, as Natalie said, we'll have this larger group meeting, but once we get our toolkit, which will have a letter to approach a business or whomever, we'll have all of that we can start using. And again, I reiterate, you can start putting up the stop privatization signs. Once this meeting is over and I can look at who has signed up, I'll be sending out an email once we're a little more organized, and just seeing who is on board, and we'll get people to spread the word, because that's what it's going to take. Talking to your neighbors, talking to your relatives, spreading the word however you can. I do believe a strong Ontario-wide campaign has the ability to make the government finally listen, fall to their knees, and we can save our publicly funded hospitals, and in the end, save our valued healthcare system. So again, I just, like Natalie said, and I reiterate, can we count on you here to join us tonight? And if you have any questions, we have a few minutes left. I know it's 7:56. I think we're right on target. If there's anything that is outstanding that you really need clarification for, please, you can ask it now, or just again, get in touch with me. So I would like to thank everyone. I'd like to thank Bernie, Natalie, Riley for doing all the tech behind the scenes, and thank all of you for coming out tonight, because I know we can make a successful referendum in Haliburton County. Thank you so much.
Bonnie, we love you and thank you very much. We'll send a follow-up email with stuff. We'll save that chat, okay? And if there are local, I don't know if because I missed it, but if there are local or nearby actions to help with the nurses, we'll put them in the email as well. So we'll get that out as quickly as we can.
Great. Well, thank you, everyone.
I just need to clarify the meeting, the picket in Bancroft, because some of you may be closer to Bancroft than driving to Peterborough. If you want to support that picket, it is not what it says on the ONA website. I did put the time here. It's from 4 to 6. It's in front of the old Vance Motors, because Vance sold, which is the Dodge dealership on the corner in Bancroft. If you're familiar with Bancroft, you'll know exactly where I'm talking about.
Awesome. And there's
Thanks,
one in
Brittany.
Peterborough
That's
too.
awesome.
And the one in Peterborough, it is from 12 till 2.
And where is it again? Just to.
It
Tell
should be
people
in front of the hospital on the
Okay,
public ground.
Okay.
Yes, there will be speakers. We probably will be having speakers at each one of these. So feel free to come out and support. Thank you.
And we have people here from the Peterborough Health Coalition as well. So thank you everyone for coming. It was a great meeting. I look forward to moving forward with you all, each of you in some small way. If you can, just reach out and we'll be so happy to work together. And again, I'd like to thank the Ontario Health Coalition for co-hosting this meeting with us. Thanks so much, everyone. Have a good evening.
Thank you.
Thank you. Good
Thanks.
night.